What I was excited to talk to you about was I feel like there are a lot of misconceptions about children and how they get injured. And I know that you, as a spine surgeon, you actually see the injuries that happen from exercise. And so I wanted to first hear from you, what are the most common things that you see as a spine surgeon?
So, as a pediatric spine specialist, the most common injuries I see are things like spondylolysis. And doctors have to make up big words so we sound smart. All that means is you had a stress fracture in your spine, and it's generally down in the lower spine around L5. I want to be clear though, when they look at back pain in children, spondylolysis is probably a cause in less than 1 in 100 children. By the time they get to me, I'm seeing, kids who have stress fractures of their spine, but the average kid who has back pain, it's just going to get better all by itself. People shouldn't overreact to back pain. One of the things I tell them is welcome to adulthood. It's only going to become more frequent.
This is, this is true. It's hard to meet an adult who has never experienced back pain in their life. This is true. So, and my question is, so I know we call them spondies for short, but when you see a spondee, what are the common reasons why kids have spondies?
Yeah, so that's a great question because spondies are actually present in 6% of the population. Most people don't even know they have it, and it has to be somewhat genetic because 37% of Eskimos have it. And most people have it, they don't even know it, and it's not a problem. The only time it's a problem is when it causes pain. So we tend to see it in athletes, particularly athletes that bend backwards a lot, like gymnasts. You see all this crazy stuff of bending backwards so many times, and many times it literally leads to a broken spine. We also see it in all kinds of athletes like pitchers, baseball pitchers. In Division I baseball pitchers, 17% of them had at least the beginnings of a spondee on a bone scan because they do such violent, repetitive twisting motion. So in general, we think, repetitive, violent motion about the spine could be a big contributing factor to spondies.
That's so interesting. In medical school, we really focused on gymnasts getting spondies, but I never realized that it can happen incidentally as well.
What's fascinating now is I'm seeing it more even in volleyball players and other athletes. And I think part of what contributes is more and more children are being encouraged to just do one sport and maybe overdoing it. All of a sudden they're supposed to do one sport all year round, many hours a day, and the rate of overuse injuries, of course, is going up.
So this is what I'm excited to talk to you about because when I've heard you lecture in the past, I love how you're a surgeon, but you've emphasized ways to prevent injury from happening in the first place. And so,
Yes.
and so in particular, you did a study showing the benefits of sleep and injury prevention.
Yes, so it's interesting. This is the #1 downloaded study of all time in the Journal of Pediatric Orthopedics. And we went to a local high school, Harvard.
By the way, that has to feel good.
Oh, that's awesome. So the only reason I started doing research is because my grades weren't good enough to get into ortho. I completely came from a place of weakness. And I realized it was kind of fun. So anyways, this high school called Harvard Westlake in Los Angeles, and they keep psycho good records on every injury that ever happens to an athlete. And I had this theory that we were maybe overtraining our athletes. And we asked questions and tried to figure out, is injury related to maybe going to a separate coach once you get home, or another team, or lifting weights, or how many hours? And at the very end, just as a goof, I threw in sleep because I'm a big fan of sleep. I take a nap every day, actually. And it turns out that nothing mattered except for sleep. And in fact, those kids who slept less than 8 hours a day had 70% more injuries. That is a massive effect in medicine. And if there was something for sale, we'd be seeing this for sale with billboards all over the world. But because no one really makes money on sleep, I don't think it's been quite that popularized.
Wow. So just to summarize, kids that slept fewer than 8 hours a day were 70% more likely to have injuries. Now, what kind of injuries are we talking about? Like sprained ankles?
Yes, the most common injury in a high school athlete is a sprained ankle, and the injury was defined as any athlete that was sent to the trainer. So if you were sent to the trainer for an injury, that was included. Yes, of course, things like sprained ankles would be number one. And one would ask, if you're tired, why do you sprain your ankle? Well, there's a lot of literature in, airline pilots, truck drivers, military. If you're short on sleep, you become a little bit slower in your reaction time and your judgment goes down. So it kind of makes sense that you're more likely to find yourself getting hurt.
That's fascinating. And how did you pick this as an area of interest to study?
Okay. So again, this might come from a position of weakness, but if I don't take a nap, I get kind of cranky sometimes or sad. So even when I was a surgical resident, back in the day, you'd walk uphill 2 times in the snow and you'd literally work 100-hour weeks. So I would do everything I could to just get 5 minutes of shut-eye, and I got pretty well trained to just fall into REM really quickly. And I think it makes all of us happier. And I wanted to prove it. And I guess, when you say something and your children make fun of you, you want to prove you're right. So maybe that's why I did the study.
For me, when I hear you describe this study, it really exemplifies how important rest and recovery time is for athletes.
Absolutely. There's no question. One of my friends, a guy named Pau Gasol, played for the Lakers when they were winning championships. And he used to say that the rest is equally important to the training. As he watched at the highest level of athletics, what limited people was not training enough. It was training too much and getting hurt. So I guess I could say this. If you watch the NBA games, during the regular season, it looks like they're kind of dogging it. He's like, yeah, of course they're dogging it. They just don't want to get hurt. All that matters is the championship. So I think that rest is a very understudied, underreported, undervalued training tool. However, just after this study came out, I remember the professional soccer team, Galaxy, I was chatting with their coach at the time when they were winning championships. He goes, this is absolutely true. I notice if the guys go out the night before, they don't play as well the next day. And some of the teams even started putting things like Fitbits and Oura rings on the players, to try to track their sleep. Now, there was an unintended consequence. It turns out if the players woke up and they saw from the Oura ring that they had a bad sleep, it could become a self-fulfilling prophecy, and they thought they were going to have a bad game. So apparently they took the rings away from them.
It's so interesting. I mean, sleep is something that inherently it makes sense that it's really good for us, but I love that you were able to show with medical research, validate how important it is.
Yeah, especially for our children. What I worry about in our kids now is just more and more put onto their plates. And one of the things that suffers is sleep. I think at some of the most intense schools, it's almost a badge of honor not to sleep. I would know it was somewhat in college or med school. You'd I just pulled an all-nighter. Man, I'd do horrible if I pulled an all-nighter. I'm just not that tough.
I completely agree with you. All throughout my medical training, it definitely felt like a badge of honor to stay up at all hours, to not need much sleep. But for my mother-in-law, who thankfully listens to this podcast every week, she is, I know, smiling and nodding in agreement with everything that you're saying right now.
Great. And then one of the interesting things is, I train surgeons, which is just one of the most fun things in the world. And when you're a surgeon, you're trained for thousands of hours to be technically superb and make the right diagnosis, think clearly, but you're not really taught how to lead a team. And all of a sudden you go into the operating room as a new surgeon and you're leading a team. It could literally be life or death. And one of the interesting concepts in leadership is there's good studies showing if the leader sleeps well, they do better as a leader. And if the leader has a bad night's sleep, the team notices it. The teamwork isn't quite so good the next day. So at some level, of course, it must be true for surgical decision-making and skills and mood and all the other things. But there's really, your sleep affects others once you become the leader.
It makes so much sense. On a personal note, when I get a good night's sleep, I completely feel the benefits. I can tell with my relationships, how I talk to others, how I treat others, how I feel in general. Everything's better.
Yep.
So I like your studies. This is great stuff. So on the same theme of injury prevention, As a spine surgeon, are there any other things that people can do to prevent back injury? Like, for example, I hear a lot about weightlifting, that if you weightlift and you focus on the core, that will prevent injury to your back. Is this true?
I don't know. I don't know if that study's been done, but you raise a really important point. One of the number one ways I see people injure themselves is deadlifting or squatting too much. No question that deadlifting and squatting, especially large amounts of weights, injure people's spines all the time. And if you're having back pain, yeah, it's super important to do core strengthening. And, I put together a PowerPoint of exercises that I think are great. And, instead of squatting, 225 pounds on your back, you could do much less with one leg at a time. So then you're unloading your spine, but you could still build the muscles around your core equally effectively.
That's a great tip. And the same thing with deadlifting. Do you feel like if you just emphasize one leg at a time?
Look at the mechanics of it. You have this weight in front of you, and as you lift up, the moment arm across your lower back is horrible. I've had a few kids who felt a pop, and all of a sudden they have a disc herniation pushing against the nerve, and they need surgery. And it's kind of, it's not healthy to have a bunch of teenagers, usually boys, trying to compete who can lift the most. That's a sure way to support your local spine surgeon.
So how do people know when is enough? Are there any guidelines so that people know when they've reached their max?
Yeah, I think for things like deadlifting and squats, I would go so far to say just don't do it. It's not worth the risk. But if you're going to do it, I think it's really important to have professional instruction. Make sure you're doing it correctly. I think there really is a much lower injury rate if you're doing it correctly. And, why not go for 10 reps to exhaustion instead of 1 rep max? There's no question you'll get injured less. Most of us are not trying to win the Olympic gold medal. We shouldn't pretend that we are.
I love this point because it's easy to get caught up in the gym culture where you're constantly trying to increase the amount of load that you're lifting. Yeah. So it's a good reminder that we can all get injured.
Yeah, and the other thing that we should say about lifting is there's more and more evidence now it's particularly important later in life. You all see the old person like can't get out of the chair. That's real. And as we get older, lifting seems to be more and more important. And if we don't do it, our strength will just go down over time. And the older you get, like if you're sick in bed with COVID for a week or two, it takes you a lot longer to recover than it does when you're younger. And it's particularly true with strength also.
Okay.
What you also raised was the idea of, will core strengthening decrease your injury rate? I think that's pretty much universally agreed upon. If you're in shape, if you're strong, the muscles are going to take a lot of the load instead of your back and your bones. Now, there's another area, though, that is a myth. As I say this, I know people aren't going to believe it, but stretching before an athletic event has not been shown to prevent injuries. Now, when I say something like that, it's like you're, speaking against, mommy, rainbow, and puppies. Like everyone thinks that stretching helps prevent injuries. And because of that, nobody believes the 20 or 30 studies that are out there proving it doesn't. And everyone keeps doing another study to prove stretching reduces injuries, and it's just not true. Now, a good warm-up prevents injuries. There's good things out there like FIFA 11 that a lot of the professional soccer teams do. If you warm up everything, if your muscles are warmer and more flexible, that helps, but not necessarily just cold stretching.
Interesting. So all that static stretching that I did in cross country for many years didn't do anything.
Yeah. Oh, let me do another myth bust. I love this one. So in college, I was an all-American hurdler, only because I was D3. I'm not really that good. Couldn't do D1. But I could barely touch my toes. And I got really upset. Like any time I ever talked to a physical therapist or a coach, they'd all tell me, I had a problem. I need to stretch more. I need to touch my toes. So we did another study, of course. And we correlated high school and middle school kids' flexibility to athletic performance. And it turns out if you have tight hamstrings, you jump higher. Isn't that wild?
That is wild.
We learned in medical school, as we look back, if your muscles are too long, they're not that strong. There's an optimal muscle length that is strong. And it turns out it's having tight hamstrings. Loose hamstrings, or everyone in yoga class and physical therapists tell you to loosen up your hamstrings, but I'd love to see the data on that being good.
So, in other words, if you can't touch your toes because you have tight hamstrings, it might even be favorable.
Certainly for jumping high, yeah, you certainly shouldn't feel bad about it. You should be happy because of your superior genetics.
I'm thinking of my husband. He played basketball for many years in high school and he could never touch his toes, but maybe it served him well.
Yes.
Overall, when it comes to weightlifting, do you have a stance on whether or not it's beneficial for kids or not?
Yeah, that's a good point. There is a belief out there that one should not lift weights while their growth plates are open. I don't think there's any evidence behind that. And if we think about high school physics, force equals mass times acceleration, F equals ma. And simply a kid jumping probably produces more force on his growth plates than he does lifting weights, or she does lifting weights. So my 3 children were in the weight room at age 5. That's when we started saying, hey, let's go to the gym together. And the kids all still lift, and we come home for Thanksgiving. We love going to Easton Gym together.
Amazing. I mean, it seems to me it comes down to form. If a kid is lifting weights that are too heavy for them or they're not lifting them with good form, they're going to be a setup for having an injury. But if somebody's supervising them and they're using appropriate weights, I think it seems beneficial to me.
In so many ways. And I love the fact that my 2 daughters literally grew up in a weight room. So by the time they went to college or now later in life, they are completely at home walking into any gym and not intimidated. I love how confident they are.
It's amazing. I love what a proud dad you are.
My kids are pretty good. Yeah, my daughter Jamie, who's 27, we're having pull-up contests now. We can both do 19. The problem is that she's doing more and I'm doing less.